Hello everyone, this is Nafis and you're watching the Vision 2030. So I hope most of you who are watching my video are vaccinated. So you know that I am also vaccinated and there are many people above 18 got their vaccination first dose. But what about those who are below 18? Those who are below 18, they are staying away from the education, that's offline education, and a lot of things they are scared of something like about this catching the infection, and majorly when the reports are something like the third wave where children's are more prone as per to certain reports, whereas even certain reports are there that denied this fact that there is no such evidence anywhere in the world that this third wave is going to impact more on the children. So that's a debatable topic about the third wave. But whatever the case, we get a question that when does the one below 18 are going to get vaccinated? Our newly appointed Health Minister of India has declared that probably we are going to start vaccinating the kids that's below 18 years by next month. Yeah, you heard it right. So finally, the wait is over, or we may get it by, according to the director of the AIMS also, that we are going to get it by late, means by September we are going to get a vaccine in the market where we start vaccinating the kids with the first dose. So in this video we are going to see about which are the options we are having to vaccinate the kids and why is it important to vaccinate the kids, and even though when we say that kids are having more immunity power, so then we will see all those things in detail in this video. So please watch this video till the end, and if you are new to my channel, please subscribe to my channel and press the bell icon, and don't forget to share this video with your friends. So what are the options we are having to vaccinate the kids? So in the world, there are few vaccines were already approved for the use for those of the age group below 18. So that is the age group between 12 to 18. It's been tested. That is the one major, that's the mRNA based vaccine made by the Pfizer and BioNTech company. This is one of the first vaccine being approved in the world. So I had made a video on that. That's the first video on my channel, so you can watch this from the playlist and the link is given in the description. How that Pfizer and BioNTech vaccine works, what principle does it have. So that vaccine, already the clinical trials on the children's between 12 to 18 is over, as well as a lot of countries like US, Israel, China, they are already administering certain vaccines for the kids. That includes the vaccine from this Pfizer and BioNTech and the vaccine from the Moderna. These two companies already it is in use. So these are one options which we have. We can still in India, these vaccines are not approved for the use for below 18-year-old. So we need to wait and see whether these will approve. Even if not these, we do have other options too. You all are familiar with Covaxin produced by Bharat and BioNTech. So this pharmaceutical company has started testing on the age group of 12 to 18, and that's going to complete by another 1 month. So probably if been approved, so by September Covaxin for the age group of 12 to 18 will be available in the market. And prior to that, there is one more pharmaceutical industry, that is Zydus Cadila. Cadila's vaccine has already completed the clinical trial for the age group 12 to 18 and been submitted for the approval in the emergency. So we need to wait and see when it's going to be approved, but still they had asked for still more clarity. So if been approved, we may get it in August itself. So that's a good news. And the major thing is, this is a plasmid DNA vaccine which is the first of its kind in the world. The vaccines which are available in the world right now works on different principle. Like Pfizer works on mRNA. It's an mRNA vaccine. Like that, there are different virus works on different principle. I have made a separate video on covaxin and covishield, what principle it works on. So all the things you can check out the video which from the link provided below. And this Zydus Cadila vaccine works on a principle called as plasmid DNA. So if you want to know detail about what's this plasmid DNA vaccine, write down in the comment section below. I'll make a separate video on what is this plasmid DNA vaccine. Okay. These and there are a lot of other vaccines were under test in the world, so we may have chances of getting this Zydus Cadila vaccine or covaxin by another 1 month in Indian market, and we will start vaccinating the kids. That's a very good news. Now one question arises, why does the kids has to be vaccinated? Because we say that they are having very high immune power, more than the adults. Then there are still a lot of adults in a lot of developing countries haven't got the vaccines. Then why do we need to vaccinate the kids? So definitely one reason we may think that kids are away from the schools, and by vaccinating we can start opening the schools. And the second major thing, even we can in fact we, according to the ICMR guidelines, we can still open the school by vaccinating all the teachers, because students doesn't catch the COVID-19 infection very easily, as well as they are not like the epicenter for that. We can't. So but one study has shown that by staying with the age group of between 11 to 17, the adults get COVID infection very easily. What it means? It means that even if a child of age around 12 has the COVID-19 infection, he may not have severe symptoms. But if I stay with that child, there are higher chances that I can catch that infection from that child easily. Okay, that's the situation. So that's why the adults are vaccinated. But if some adults are not vaccinated, there are chances that they may catch this infection from the kids. So vaccinating the kids is also important. And some kids, certain children also are having weak immune system. They also are suffering from this COVID-19 with the severe symptoms. So that is why we need to vaccinate the kids at the earliest, and make everything back to normal. We wish that this vaccine get into the market as soon as possible, and I appeal to all the students who are watching my video are below 18, and the parents of the kids who are watching. So please vaccinate your kids once it is into the market. So those who are having below 12 years of age, something between the age group of 6 to 11, they need to wait still more, as still the testing clinical trials not been done for that age group, and it may take more days for your age group. But for kids about 12 to 18, so you need not wait much time, probably another 1 month or 2, it will be in the market. So that's it from this video. Thank you so much for watching my video. Please subscribe to my channel and press the bell icon.